All right, welcome everyone. Welcome to Empowered RN, and we have a special guest with us. As the title suggests, we're going to be talking about chronic care management, and especially for our nurses in healthcare, right? And when I speak of chronic care, I actually didn't know what chronic care management was when I saw Natasha, who is the queen of chronic care management.
God.
Yes, I saw you on LinkedIn. I saw you on TikTok all over. And I think when you started talking about it, I started seeing more of it coming into my feed because I kept
Mhm,
liking and commenting on your stuff too.
mhm.
So I think this is something that nurses should know about. So we're going to talk about it tonight
All right,
or
sounds
this
good.
evening.
All right.
But before we dive in, I'd like to tell us some more about yourself and who you are.
Okay. All right. So, hi everyone. I'm Natasha, and so I call myself a care management strategist because I focus on all things care management and having nurses lead in that space. So, I've been a nurse for over 20 some years, 22 years, and 15 years as an LPN, and then I've been registered nurse for the past 7 years, and
Mhm.
and so after all that time in nursing, I was like, I needed to find something that would help me create income while still being able to do the things I wanted to do for patients. And chronic care management was one of the services that I found from the Centers for Medicare and Medicaid that I could partner with primary care and create a business. And so that's what I did. And that's kind of my area of expertise right now, and so yeah, empowering nurses to, you know, leverage what they know, their skills, and all of that to provide the service.
Okay, nice. To everyone that is joining us, we're live. We're live on YouTube and we're live on TikTok also. We're going to be talking about chronic care management, especially for nurses. I don't think many of our nurses know much about it, but we have an expert here with us tonight. So if you're on TikTok, you can come over on our YouTube channel at Empowered RN. And I think you're live also. I don't know if you're live as yet.
Mhm.
If not, we can share it after.
Okay.
All right, so you expounded on chronic care management. How long? I know you said that you have been a nurse for 21 years.
22 years.
Okay. So how long have you been in chronic care management?
So I've been doing chronic care management for the past 3 years.
Mm-hmm.
I started out working inside a provider practice and found that there were a lot of gaps in education with healthcare professionals. So, if doctors and nurses don't know about it, how can the patient benefit?
Mm-hmm.
So, after I started doing the care management, I then transitioned more to education and consulting, implementation, workflow, and all of that is kind of what I do now as a strategist.
Okay, nice. All right, so could you tell us like what like the definition you'd give to chronic care management for those who are watching and probably the first time they're hearing something like this?
Okay, so I would say chronic care management, it's a service that's covered by Medicare,
Mm-hmm.
and it was developed to help support patients between office visits because we know a lot of times when the patient leaves the doctor's office visit, there's no follow-up in between. A lot of times they might have questions. So chronic care management was developed by the Centers for Medicare and Medicaid back
Mm-hmm.
in 2015. So it's been around for a long time to help support patients that are living with chronic conditions
Mm-hmm.
outside of the doctor's office visits. So it's the Medicare recognized service that provides that ongoing support to patients outside the visit by monthly check-ins, reviewing medications, helping patients understand their disease, helping with appointments and all of those things. So it's supposed to help keep patients out the hospital and then also increase the revenue for a practice. So
Okay.
that's that kind of like is pretty much what it is. It's that support outside the office visit.
So it's basically supporting patients who are outside of the hospital and who would have been in the hospital before.
So it's actually supporting primary care.
Primary care. Okay.
Okay. So this is where you'd have a lot of administrative work that's not paid for appointment scheduling, all of that. And so it's overwhelming primary care and the staff. And so Medicare said, okay, well, if we pay you for this work, this is what you need to do. And they built that structured care management model, chronic care management, to help bridge that gap in care that we found patients need that support. And so that's what CCM does for primary care, give that additional revenue and kind of bridge that gap in primary care.
Okay.
Mhm.
So for those who are listening who are probably not a fan, I know somebody just say, hi, tuning in. Angelica says she's tuning in from Jamaica. Welcome. Could you explain to us like what Medicare is?
Medicare is health insurance in
Hmm.
the United States that covers patients that are 65 and older, pays for their health care. We pay into Medicare with our paychecks and stuff. So we have health insurance um, after 65. So it's Medicare. Um,
Hmm.
that's insurance in uh, the US.
Okay. All right. So you said this is like chronic care management, helping patients, especially those with the primary care aspect of it, and it's built through Medicare, as we talked about. Now, this is a big industry, especially if you look at the age range where you said 65 years and older.
Mhm.
However, where would nurses fit in with same?
Okay, so with nurses, I teach them how to partner with primary care practices
Hmm.
because one of the things that happens is primary care tends to use medical assistants or unlicensed staff to manage these programs. These care management requires the development of a comprehensive care plan, and so that is a nursing role. That is not,
Right.
that's not for a medical assistant or um, someone not qualified to do. Um, and then the clinical aspect that we bring, a lot of you won't get that from your medical assistant. We bring that clinical expertise as well, as helping patients understand their condition. So all of those things that we bring, right, our expertise helps to increase the revenue for the practice, right? And so that's the value that we're bringing. We're saving the practice time because we are using our clinical expertise to follow up with patients who may come into the office and have questions after. So we're saving the practice time, right? We're increasing the practice revenue because what we're doing is bringing income into the practice. So any revenue that they may be losing for the work that they do and not getting paid for, so we're increasing their revenue. We're improving outcomes for their patients as well because we're educating them on their condition and we're supporting them, as well as providing that medication review and all of those gaps that might be missing. We're providing that support. So that's kind of some of the things that we do to kind of bridge those gaps and avoid like the staff burnout and reduce the load on the physician as well, while increasing the revenue. So that's kind of the value that we bring as care managers, just a little
Okay.
bit.
Okay, so you have been in this industry for quite some time now. I know I asked where nurses would fit in, and they fit in quite well because from you mentioned care plan, that's
Mhm.
something that has been taught to us from even nursing school, and even
Exactly.
after nursing school, we do use it
Mhm.
sometimes.
Yeah.
However, separate and apart from that, we know there's a need for nurses. Would you say that with this industry rise, that
Mhm.
nurses like should be at the forefront?
I believe that nurses should be leading in this space because what I see happening is that a lot of software companies are coming in and saying, "Well, use our software, for CCM and all of this." So the software doesn't work without the human aspect. The software is not what's doing the work. Um, Nurses are essential to building those comprehensive workflows and developing the care plans. So you can have there are a lot of software companies that are promoting their software to improve outcomes, but the human aspect, the nurse is, actually their expertise is what's really important, in my opinion.
Mm-hmm.
And I think that there are a lot of nurse-led care management models that you can look at within practices, and you will see the ones that are led by nurses are more effective and have better outcomes. So definitely, again, because the nursing process is basically care management. You're assessing. right? You're making a plan, you're implementing that plan, you're evaluating all of that. So it's the nursing process. Um, it's just operationalized inside of primary care and care management. So that's why I think that nurses should be leading in this space. Understanding the value that they're bringing to a practice, and that it's a team effort, right? Because the physician, they're taught a different way than we are, right? We
Right.
are taught education and all of that. They're taught medication and and their treatment, so they will develop a treatment plan, and then we can use that treatment plan and create a patient-centered care plan to support that physician and support the patient's goals as well. So it's valuable to all involved.
Okay. So this is an industry that nurses should be leading and should be at the forefront.
Mhm.
But before they do leading and being at the forefront, many always ask, how much experience do you need to go into this? Do we need any certifications? Do we need to go back to school? Whether do we need a master's, a degree?
Right.
How do you start?
Right. So you're a nurse,
Mm-hmm.
and so that's your qualification, right?
Mm-hmm.
We are taught care coordination or coordination. Most of our roles um, kind of like center around coordinating care. I worked in long-term care, and even just as a nurse working on the floor, I've worked in management, all of that. We're coordinating that patient care, with different providers and all of that. So for me, I knew that I could do it. I did not need any additional certification. It's not case management. Um, it's care management. And so even medical assistants can do it, right?
Mm-hmm.
But again, if you're following CMS guidelines, you do require that care plan.
Mm-hmm.
So with nurses, again, leading that allows you to partner with practices, and I totally forgot what my train of thought there, right?
Right. We were asking like the licensing and the
Oh yeah,
certification.
yeah, yeah. We don't. Yeah, you don't need it. So just your expertise. Sorry,
Mm-hmm.
your expertise is all you need. You don't need any additional certification to deliver care management services, because again, it's already what you do and it's what you learned in school. No additional certification. And you had another question beside the certification.
Uh, no, so no certification. I asked about license. Do you need a
How
license?
your nursing license, your nursing
Yes,
license,
license.
and how much experience. And there's no real guideline on experience, right? If you've been a nurse, I like to say if you've been a nurse 5 years, that's enough experience, because you've done all of the work. But that is actually not required. You could have been a nurse, 2 3 years and feel confident enough to say, hey, I know how to manage a patient with
Mhm.
diabetes. I know what's required of this, so I can do this.
Right.
So no set rule around it, but I kind of say maybe 3 to 5 years. That kind of gives you enough knowledge and experience to say, yes, I can,
Mhm.
support this patient and effectively manage their care.
Okay. So we
Mhm.
talked about that nurses should enter the industry, they should be at the forefront. But if someone who is listening right now and hearing all of this and say, hey, I've done care plans every day I go to work for my 12-hour shift, I've been doing this over and over. I can manage a patient in diabetes and hypertension.
Mhm.
How do they go about starting something like this?
So, for me, being in the US, and I know you talk to a lot of international nurses, um, it's a CMS program, so a program from the Centers for Medicare and Medicaid. So I always say start learning about the service,
Mm-hmm.
and you can just look up chronic care management from CMS online, and look up the requirements, all of that, and that's where you start.
Mm-hmm.
You start learning about the program, and of course, I have an online school that
Right.
has a community. Um, with other nurses in care management, and I kind of go live in there to teach them things to other nurses. So my
Mm-hmm.
online school, and then my YouTube channel as well. Um, Nurses in care management, nurse entrepreneurs in care management. Listen,
Okay.
that's
So
what
you
it
have
is.
school, and school is a social media platform for our
Yes,
community. So
yes.
you can follow her
SK,
there.
SKOOL,
Right.
and that's
Escape.
Empower Care Academy.
Okay. Similar empowered our end. So this is
Right?
Empowered
Yes,
Care Academy.
me. Yes.
Mm.
And my YouTube channel is Your Care Management Nursepreneur.
Okay.
You
So
know.
separate and apart from that, I know you said you can do the CMS, that's like a course or something, but I know you provide mentorship, and that's really important too for anybody that is interested to launch into something, to
Mhm.
find somebody who's actually doing the job. So you could speak to us right now for anybody that is watching. How do you, what services do you offer, and how you already listed how where you can be found. So you could just speak on the service.
Okay, so I do offer mentorship to nurses who are looking to start their business in care management. I have a course that provide teaches you how to market your service, how to position yourself, and the goal is to help you get to that first contract. And so I give you the foundational knowledge that you need to build that foundation to be prepared to step out and say, I am ready to partner with a primary care practice to deliver these service and kind of get that business started and grow and scale from there. So that's what I do as a mentor because I believe again that nurses should be leading in this space and that a lot of nurses don't know the
Mhm.
opportunity that's available to them. And they kind of look at all the other things that they can do, but with care management, you have your knowledge. You don't need additional licensing or education, um, and and you can do this from home.
Right. I was going to ask you that. So when you set up
Yeah.
this business, it's something that you can run with an office space from your
Mhm.
home.
You can work from home. It can be provided remotely under general supervision. That means the physician does not have to be present for you to provide the service, and so that allows you to work from home, um, depending on how you want to structure your business. If you want to do more, again, you can offer that service. So I kind of work with you to build out your business, how you want it to work for you.
Right.
Um, but give you that basic foundation to step into the space and then grow from there.
Okay.
Mhm.
One question that I had, probably didn't write it down. I know you said that we can outsource to like private care practices. But would it be similar to that of like home health or hospice, those services?
So with chronic care management, because you're managing that patient care, if a patient's on hospice, they're not eligible for chronic care management because that care management is part of the hospice benefit.
Okay.
If a patient is on home health care as well, they cannot receive the chronic care management, but they can receive remote patient monitoring, which is where we utilize the devices, blood pressure monitor, glucose monitors, to
Mhm.
monitor those readings remotely. And that also includes a component of care management with it. So if they're in home health care, RPM can support those patients with diabetes, high blood pressure, and then once they completed that home care course or whatever, then they can transition to chronic care management. So
Okay.
understanding who's eligible and who's not eligible is important as well because they those won't be eligible. But again, there are other services from
Mhm.
CMS, like remote patient monitoring, that includes the care management aspect that you can offer as well to patients.
Okay. One last question. I just keep saying one last question, but what about this service? Can we do have international nurses here, but I don't to the US based on how the services are offered too.
Well,
And
actually, so
okay.
um, it's as a, I guess, international nurse. I don't know if I'm an international nurse, but I am from Trinidad as well, right?
Mhm.
And so care management is a universal service, right? So I am actually working on setting up my business in Trinidad as well, offering remote patient monitoring and care management as a concierge model.
Mm.
So this way you get paid directly. You don't have to go through insurance because the insurance industry is set up differently in the Caribbean. Um,
Yeah.
so it can definitely be something that can be structured and offered to patients living with chronic conditions in the Caribbean because we know they have the same issues, and so it would benefit them as well. So yes, so it's definitely possible to do that. So it's not something that's just limited to the US. It just has to be structured differently. Um, but the foundation of what we're doing and how we're serving patients remain the same. So that's what's important, and
Okay.
yeah, we're able to do that.
Thank you so much. I definitely learned a lot, and I hope our viewers and those who are listening learn. And I thought Angelica was here. I don't know who else was here from Jamaica, but other persons will be tuning in for same. Definitely think that this is a niche that nurses need to tap into and to run their businesses. So thank you so much, Natasha. She is a queen of chronic care management. Yes. And if you're interested to start, run your business in this area, this is who you go to, the mentor. Yes. So, a nice question that I like always to ask before we end the program is, the importance of nurses stepping out and launching businesses. If
Mhm.
a nurse is watching this right now and she's feeling stuck and actually wants to go into running her business, what advice would you give to that nurse right now?
What advice would I give? I would say feel the fear and do it anyway. Because for me, taking that first step was really scary. I held on to a lot of information for a long time before stepping out. But once I took that first step and got over the fear,
Mm-hmm.
um, I grew immediately after I posted about, that first contract that I got. I got a coach to teach me what I was doing because I really had no clue what I was going to do next once I asked for the
And
contract.
you see,
So,
just not to cut you, got the contract and then you got the coach.
yes, yes. I went to my primary care and I was like, listen, I can do this. Let me do this for you. And he was like, yeah, okay. And then I really had no clue what to do after that. But once I got that yes, the coach showed up, the support showed up, other nurses who were doing care management reached out, and so over the past few years, I've learned a lot and I've connected with a lot of other nurses doing the same thing. So feel the fear and do it.
Do it
Take
anyway.
that first step. Um, Listen, my faith is just really big. Have that crazy faith that it's going to work out. And for me, that's what works for me.
Yes,
Um,
great.
yeah, just do it.
Angelica had a question. She's asking, is it similar to care in the nursing home? Can you say who is eligible?
So it's not similar to care in a nursing home. This is outside in your community. So you have your primary care physician. Normally you have your primary care. The patient just goes in and sees the doctor. No one's checking in after that. So that
Hmm.
is where we're coming in the community, before they end up in acute care, before they end up in the hospital. So we're in the community. That's where we are.
Okay.
Right. And then what was the other question?
She was asking who is eligible for same.
Okay, so who's eligible? So patients on Medicare or Medicare Advantage plans, with two or more chronic health conditions that are expected to last 12 months or more, that might place them at risk for a decline, or hospitalization. So those patients are eligible for chronic care management under the CMS benefit.
Okay. I hope that answers your questions, Angelica. And she also, any other questions, just post them in the chat. She also asked, I want to start a nursing service.
Mhm. So I'm not sure if you want to start a concierge care management service, where you're offering that service directly to
Hmm.
patients. That is definitely an option as well, because as a nurse, you know what your knowledge is. You package that service and you start marketing that directly to the patients who need it. So it's certainly something that can be done as a concierge
Hmm.
service. Yeah.
All right. So I hope that answers your question, Angelica. If you have more questions, you can post it here. So, she said package, offer the service. And if you want a mentor, I don't know. I think she said she's in Jamaica too. And, Natasha says she's from Trinidad and she's looking to start in Trinidad. So you could probably reach out to her for some mentorship or some services that you want to start. All right. Any more questions? Thank you so much for tuning in for those who are here. And thank you so much to our guest, our mentor, Natasha, who is a chronic care management concierge, guru, expert. Yes.
Thank you. Thank you. I'm a
Um,
strategist. I'm a care management strategist. You
strategist,
know, we look
yes.
at all the strategies and ways that we can implement care management that can really help patients and
Mhm.
also help nurses. It's a win-win-win for everyone. You know, patients,
Yes.
providers, and nurses can all work as a team and really improve outcomes because we need to be more proactive instead of
Mhm.
reactive. So that's the focus for me.
Yeah, so that's very good too. And she says, okay, so I guess I answered her question. I think also back home, these are some services you could look at implementing too.
Mhm.
But the model is different, but you'd have to package it and structure it towards that country.
Exactly.
So happy to have you here, and thank you to Angelica who was tuning in from Jamaica, and to anybody that is watching this. As nurses, we are the blueprint, and I strongly believe that we have everything that it takes that we can launch our businesses. I
Mhm.
often say that degree that we got was a skill. It's a skill. So many items that are checked off on it that you can actually turn into
Yep,
a
exactly.
business.
Yes, yes, yes. So,
All right.
all right.
I think it's
Okay.
5:29, so 30 minutes. So thank you guys so much.
All
Thank
right.
you to everyone. And that's it.
All right. Thank you so much. Bye.
All right. Bye.
All right.